I've been having fever, I've been having cold hand and feet. Also, I've been confused at times, and I've been vomiting. I've been having this severe headache and severe muscle pain as well. My neck been really stiff, and also I've been, like, every time I hear a noise, like my legs really hurt, and also I've been very confused at times, and I was finding it really difficult getting up this morning.
Okay, well, your symptoms are showing some characteristics of a disease called meningitis.
What is meningitis?
Meningitis is the inflammation as a result of infection of the meninges caused by bacteria, fungi, viruses and parasites. There are 3 layers of the meninges. The dura mater, made of the meningeal and periosteal layers. They are made of tough fibrous connective tissue protecting the brain. The arachnoid mater is a serous membrane which is avascular. The cell barrier is full of densely packed desmosomes with tight junctions, preventing fluid movement and forming the blood-brain barrier. The subarachnoid mater contains the cerebrospinal fluid, which again helps protect the brain. The pia mater is the last layer, made of delicate connective tissue. It envelops the brain and spinal cord and contains many of the major blood vessels. Meningitis was first discovered in 1805 in Europe and 1806 in the US. 1913 provided the first meningococcal serum. In 1944, penicillin was first used to treat meningitis, and from 1974 to 78 were the first vaccines for meningitis.
Have you travelled recently?
Widespread use of conjugate vaccines has decreased the incidence rates. H. influenza type B meningitis has been estimated to affect 400,000 children below the age of 5 annually, of which 100,000 die. In the UK, over 50% of all cases of bacterial meningitis are found to occur in children under 5. The Meningitis Research Foundation has estimated that since 2000, about 3,200 cases occur every year. A vaccine has not been approved for the newest strain, Meningitis vexero, and it has been seen to be causing more cases than meningococcal C strain since 2001. It is predicted as a result that cases of meningitis will increase in the UK. Meningitis is most predominant in the sub-Saharan Africa, according to the surveillance. It is known as the meningitis belt, which stretches across Africa from Senegal to Ethiopia. This region is known for suffering from meningococcal meningitis, as it is the only form of meningitis that is capable of causing an epidemic.
Now, I haven't travelled recently. What could have been the cause? Bacterial meningitis are usually severe even though in the recovery. The most common bacteria which cause the infection are Streptococcus pneumonia, which affect patients from age 25 to 65, Neisseria meningitis, which affect young adults, and Listeria monocytogenes, which affect newborn and elderly patients. Viral are the most common form of meningitis. The infection usually less severe and doesn't require specific treatment. The main viruses that cause the infection are intravirus, HIV, fungal meningitis are very rare and the infection is non-contagious. Immune-compromised patients like HIV and cancer are at higher risk of the infection. Non-infectious meningitis can cause by cancer, certain drugs, or patients who had transplant. Parasitic meningitis is very rare and is caused by Naegleria flora, which usually enter the body through the nose when swimming or diving in freshwater place.
So before we can give you a definite diagnosis, we actually have to carry out a number of tests in order to confirm the disease that you've got.
Several tests can be carried out for meningitis, such as blood tests, CT scans, MRI scans, and lumbar puncture. Blood test is done to check for the presence of bacteria or viruses that can cause meningitis. CT scans and MRI scans are done to identify increased intracranial pressure, integrated circuit masses, or midline shift. If there is no focal neurological findings, CT scans and MRI scans are not needed. CT scans are done only if the patient is stable, but if they are rapidly declining, lumbar puncture is urgently performed. During lumbar puncture, also known as a spinal tap, cerebrospinal fluid is drawn from the spinal canal and is sent to the lab for immediate analysis to check for the specific microorganisms that may have caused the meningitis. The doctor may also do the glass test. The glass test is simply done by placing a clear glass and pressing against the skin. If the rash doesn't fade, it's a sign of meningococcal septicemia, which is the same bacteria that can cause meningitis.
But I never get cold or flu and have really strong immune system. So how could this infection affect my hearing and my eyes and things like that?
Most cases of meningitis are caused by an infectious agent that has colonized in the host. The human nasopharynx is a reservoir for meningococci and other pathogens which can colonize asymptomatically and traverse into the bloodstream, survive host defense mechanisms in the intravascular space, invade the blood-brain barrier, and survive and replicate in the subarachnoid space, producing disease. After invading the bloodstream, pathogens are able to travel into the bloodstream to the brain, where the meninges create a blood-brain barrier. However, the presence of a pathogen in the blood creates an inflammatory response which disrupts the integrity of the blood-brain barrier. Bacterial replication takes place in the subarachnoid space, and this leads to increasing numbers of inflammatory cells and cytokine-induced disruptions. Interleukins and chemokines and cytokines, such as tumor necrosis factor alpha, are major early response cytokines that trigger a cascade of inflammatory mediators, including reactive nitrogen and oxygen. The resulting inflammation and immune response does more harm than good. The neutrophils and cytokines all cause further inflammation and increased blood-brain barrier permeability. Eventually, hydrocephalus, interstitial edema, and cytotoxic edema all result in massive increased intracranial pressure, and this results in massive neuronal damage that can be lifelong. It is this neuronal damage that causes cochlear damage, hydrocephalus, and cerebrovascular complications.
So over here, your test results are showing that you do in fact have meningitis.
Well, what is my treatment option?
Treatment of meningitis. If the patient has a bacterial meningitis, the patient will immediately be given an intravenous antibiotics even before the test results are back, and initiate the treatment as soon as possible. The duration depends on which bacteria that caused the infection and will continue receiving antibiotics until it's fully cured. If the patient has a viral meningitis, because it's a viral meningitis, antibiotics are not effective against treating the infection. Often it requires no specific therapy. The infection is cured on its own within a few days or 2 weeks. If the patient has a fungal meningitis is treated with antifungal medications, usually through an intravenous line in the hospital. The duration of treatment depends on the patient's status of the immune system and the type of fungus that caused the infection. The patient who has a weak immune system takes longer time for treatment.
Is it infectious? Was there any way I could have prevented myself from getting it? Also, how am I going to prevent other people from catching it?
Okay, so there's several ways to try and prevent yourself from catching diseases. There's precautionary steps that you can take, for example, just practicing good hygiene or maintaining a healthy lifestyle. Also, when other people are quite unwell, you should try and prevent yourself from being in close contact with them. But the main way of prevention is, of course, to be vaccinated. And there are a few vaccinations available in the UK. So, for example, there's the MMR vaccine, which helps to protect you from mumps, measles, and rubella. There's also the Meningococcal vaccination that basically helps to protect you from the meningococcal bacteria, the group C bacteria. There's also the Men B vaccination, which helps protection from group E bacteria as well.
Well, what's going to happen to me now? Is my infection going to get worse?
Viral meningitis has an excellent prognosis compared to bacterial meningitis and can be recovered from within 10 days. Generally, it's not life-threatening, but occasionally it can lead to neurologic sequelae, but that's dependent on many factors. The prognosis for both bacterial and viral depends on many factors. These factors range from the age of the patient. Infections in the elderly and babies during the neonatal period are associated with higher mortality and morbidity. Time since the infection was acquired, how long you have been suffering. So early intervention can have a major impact and will lead to better prognosis.
So the good news is that you've got viral meningitis, which basically is not as severe, and you could recover from it within a couple of days.
So thank you very much. You've been so informative.
You're welcome.